Hello, Courtney. Hello, Joe. Thank you so much for connecting with us today. I'm Fiona Miller, as you know, from the University of Toronto in Cascades, and you're there on behalf of CAPE and many other organizations. Really interested to know why you go to these COPs, how many times you've been, why it's important for folks like you to go.
I'm just counting in my head right now. I think this is my fifth. So, as you know, the environment and health have been siloed for far too long. And when I read in the Lancet in 2009 that climate change is the biggest health threat of the 21st century, I was very surprised. Of course, my patients weren't, because I read that in the Nubik, which is already 3 degrees Celsius warmer than it was when an 80-year-old elder was born, which is resulting in unstable ice, drowning potential, food insecurity, mental health challenges, wildfire smoke, evacuations. So tons of really discernible health impact. But like so many things in medicine, I can treat the effect in the emergency department, but I can't help prevent it from there. And so as emerge docs often do, you start to want to go upstream. And that means you have to get yourself into the decision-making spaces where the decisions are being made around policies, around the allocation of funding, on the issues that are of relevance to your patients, to trying to keep them out of the emergency department. So some things we've been working on here, we actually just gave a presentation in the Canadian Pavilion this morning, detailing some of the things that have worked for the Canadian Association of Physicians for the Environment. We've been at this for over 25 years, which is a lot longer than most similar organizations in the world. So we've built up a bit of a history of having been able to figure out how to be helpful. So we supported the national price on carbon. Joe in particular, and also the rest of the team were quite important voices pushing for the accelerated phase out of coal. We supported the implementation of the Canada's new food guide, writing policy briefs and doing media around the importance of a planetary health diet. And because we've been at this longer than almost anyone else, there's a real opportunity for us to come to spaces like this, participate in the Global Climate and Health Alliance work. I'm here as the head of delegation for the International Society of Doctors for the Environment, and help increase the game, help raise the game around the world at the same time as we influence our decision makers. So last year, I've heard from Health Canada that it was helpful that I was at COP in order to pressure Minister Guilbeault to sign up to the WHO Low Carbon Resilient Health Systems Framework. This year, we've managed to make connections between the Powering Fast Coal Alliance and the Global Climate and Health Alliance, the Lancet, so that we can help other physician communities learn how to phase out coal. So looking to be helpful in ways that are helpful both at home and internationally.
Great. Yeah, I don't have quite as complex an answer as Courtney does, because in a lot of ways, she's my mentor. I'm her mentee. When Courtney first went to Paris, I remember her vividly going, "You want to come?" And I really debated, because, getting on a plane and using all that carbon to fly across the world to maybe not even have an impact, it was just so intimidating for me. I balked and I balked and I balked again. This is actually, I guess, my 1.5 off, because last year I came with my daughter, who's 15 years old, and she was 15 at the time. She's suing the federal government for a just climate set of laws, so that when she grows up, she has a functional society and world to live in. And so I was basically her chaperone, and I was all on the outside. And I started to see why it was important through that process. And so this year, they really dove in. We've gone from having Courtney go and kind of representing not only Kate, but all Canadian doctors in these things, to having a delegation of 5 people. We have 2 staff, the 2 of us as board members, and we have 1 member with us as well. So we've really quintupled our size, and I think we could be really effective. It's my first day, so I'm just learning the ropes.
Oh my goodness!
She already asked a really hard-hitting question of the minister, so he's getting off to a good start.
What were you able to ask?
Oh, I was just, the math is so hard on climate in Canada with, I can't remember the exact number, but it's something around 250 megatons of emissions from Alberta, and the rest of the country, like the whole country, is around 670. So Alberta alone is about 40% of the emissions for the whole country. Our emissions are climbing where everybody else is dropping. The math is just so hard for them to get to actually accomplish anything. And until they acknowledge the difficulty of that and put in some strong policies, we're just not going to meet our end in speed. I think it's important for Canadians to recognize that and also our government.
Right. So much to think about, I guess, just in terms of a just transition in Alberta, for the people of Alberta as well.